This is Selma Schimmel, and you are looking live at the great city of Chicago, which is once again playing host to the American Society of Clinical Oncology, ASCO. This is ASCO's 49th annual meeting, and this year's theme could not be more appropriate: Building Bridges to Conquer Cancer. More than 30,000 of the world's foremost cancer specialists are here, and so is the Group Room, making our 15th appearance at ASCO and one of our very best. Joining me now is Dr. Joanne Mortimer, Director of the Women's Cancers Program at the City of Hope Comprehensive Cancer Center in Duarte, Southern California. Hi, Dr. Mortimer.
Hi, Selma.
Welcome back.
Thank you.
I recall reading somewhere, preparing for the meeting, that there was some more tamoxifen and 10-year data.
You're absolutely right. There was another trial that basically, the ATOM trial, that validated the ATLAS trial. And these were studies that basically looked at the prolonged administration of tamoxifen in women with hormone receptor positive breast cancer. And this study validated what was seen in the previously reported study from San Antonio, that longer administration of tamoxifen was actually advantageous from a disease-free and an overall survival standpoint.
So this is great on that level, on a clinical level. For many women who have to go through some of the side effects associated with tamoxifen, this may not be, you look forward to, okay, 5 years, but now 10 years. What's going on, like, on the psychosocial front and helping women? Are women excited about this, or are women feeling, is there some pushback?
I think women with breast cancer who've been on these therapies sort of go both ways. Sometimes when you have really miserable side effects, that's obviously not desirable. The biggest long-term side effects that we worry about are getting blood clots and uterine cancer. And that is a real side effect of being on the prolonged administration of tamoxifen. On the other hand, women that take tamoxifen for prolonged periods of time actually have a lower risk of heart disease. And there's improved bone health, and your lipid profile is generally better. So those sorts of things that you can't see or feel are actually improved by tamoxifen. It's usually a long discussion you have with people about the pros and cons of staying on for an additional 5 years with tamoxifen. I think a lot of women feel comforted by the fact that they're still on therapy. When you stop therapy, that safety net of doing something about your cancer is taken away.
As this 10-year study becomes, there's more and more evidence to support it, will that 5-year protocol just disappear?
So the hard part, that's a really good question, because we've kind of gone in a lot of patients from giving them 5 years of tamoxifen to 5 years of an aromatase inhibitor. And there really aren't studies that look at tamoxifen after 5 years of an aromatase inhibitor. We don't have those results. Right. And we don't look at picking up the 5 years of Arimidex or letrozole or exemestane with another 5 years of tamoxifen. So we sort of don't have the data that we really need for the majority of women who get a 5 years of endocrine treatment.
Are there any other quality of life relating to breast cancer studies or news that you would like to share with us?
I think women with breast cancer quality of life is incredibly important. Mostly because there's so many breast cancer survivors. They dominate the survivorship population. And they have a lot of side effects that, we don't totally appreciate. I think the one that probably has gotten the most evidence-based data recently reported is around neuropathy from taxane therapy. So women who get Taxotere or Taxol as adjuvant therapy have a significant incidence of neuropathy, and women who have metastatic disease have a lot of neuropathy. And there was a trial that was published in the Journal of the American Medical Association looking at Cymbalta, duloxetine, as treatment for neuropathy associated with these drugs, and it did actually improve neuropathy. I think that's been huge, and I hope people embrace it, because when it works, it does work, and neuropathy is a pretty awful thing to have.
Thank you very much, Dr. Joanne Mortimer, Director of the Women's Cancers Program at the City of Hope Comprehensive Cancer Center in Duarte, Southern California.
Thank you, Selma.